I'm Mrs. Princey, Associate Professor in Mental Health Nursing. I've got a case of a 40-year-old man who presented himself to the emergency department with the complaints of difficulty in breathing. He was found feeling confused, stressed, and anxiety. Over the past 6 months, the client had these complaints and had several instances where he felt the intense fear that would reach its peak within few minutes. During these instances, he would also feel and experience the symptoms like sweating, heart palpitations, chest pain and discomfort, and shortness of breath. It worried him to such an extent that he had the apprehension or the fear of death because he kept on persistently worrying that he may have another similar attack. He began avoiding unfamiliar places and people because of the fear that any time that he could have a panic attack and it may be difficult for him to seek the help. Yes, you see, the attack which has happened for this client is a panic attack, right? So, the topic for today is the panic attack and the panic disorder. Continuously, if the client is experiencing such kind of attacks persistently, he can end up with the panic disorder. That means chronic panic attacks can lead to a disorder called as the panic disorder. This kind of a panic disorder is potentially disabling disorder but can be controlled and can be treated. Because of the intense symptom that the patient experiences during the panic attack, it may be mistaken for a life-threatening condition such as the heart attack. People frequently go to the hospital emergency room consultation when they're having such kind of panic attacks, thinking that it is the physical symptom of the heart attack or a sign of myocardial infarction. Panic attack lead to surge of overwhelming anxiety and fear where the patient experiences the symptoms like palpitations or heart pounding or difficulty in breathing, feeling of dizziness, feeling of apprehension as well as becoming dizzy. So that is a brief introduction about this disorder, panic attack. Let us see the meaning of the panic disorder. Panic disorder is an anxiety disorder characterized by repeated or by recurring severe panic attacks. It may include significant behavioral change lasting at least for a month and of ongoing worry about the implication or concern of having another attack. So, what is this panic disorder? It's nothing but a type of the anxiety disorder wherein the person recurrently has got this panic attacks, which can predispose him to have the fear of having another attack. These are otherwise called as the anticipatory attacks because the client anticipates that he may have another panic attack. Most of the clients who suffer with this kind of a panic disorder also have a comorbid condition, especially related to the agoraphobia. Let us see what is the reason or the cause for the panic disorder. Although the exact cause is not clearly found, it is found that it runs in the family. So, genetic predisposition or the person who is specially related to the first degree relatives who are having this kind of a panic or any kind of a panic disorder can develop this kind of a disorder in the other family members. There is a connection found between the major transition that happens in the life of the person. It can be transitions such as graduating and joining a occupation or a work, getting married or having a baby, exposure to severe stress such as death of the loved person, divorce, loss of job, cut. All these situations can even trigger the panic attacks. It is found that people who take up the excessive responsibilities can also suffer from these panic attacks frequently. Apart from this, it is found that people who had a history of PTSD, that is post-traumatic stress disorder, can be also prone for such kind of a panic disorder. It is found that the comorbid conditions such as hypoglycemia, hyperthyroidism, mitral valve collapse, labyrinthitis can also aggravate the panic disorder condition. So that is about the etiology of the panic disorder. So it can run in the family, it can be a comorbid conditions or any exposure to the stress or life transition when the person is not able to adapt and cause him to develop the anxiety and have the panic attacks. Moving on to the psychopathology, it is found that there is a connection between the neurotransmitters as well as the panic attack. Individuals with the panic disorders are found to have the imbalance in the neurotransmission or the chemical substances within the limbic system. One of the neurotransmitters which is very much responsible is the GABA. One of the neurotransmitters which is very much responsible is the dysregulation of the GABA, that is gamma aminobutyric acid, wherein the reduced level of the GABA sends the information to the amygdala, which is actually regulating the flight and fight response. This response will produce the physiological symptoms or the disorders in the client leading to the panic attack. So that is the psychopathology of the panic disorder. Mainly the dysregulation, lower level of the GABA will trigger this amygdala, which is going to lead a response of flight or fight response, which produces the panic attack symptoms. Now, what are the signs and symptoms of panic attack? We have got the physical signs and symptoms related to the autonomic response, such as tremor, tachycardia, tachypnea, hypertension, sweating, GI upset, which are often accompanied with the hyperventilation. Patients may have the suicidal thoughts or ideas since the panic attacks can lead to the impulsive acts towards the self. So this risk of suicidal attempts is more when there is a comorbid conditions like morbid depression, alcohol or substance abuse. So what are the exact symptoms of the panic attacks? We have got the symptoms of palpitations, pounding heart, and accelerated heart rate, sweating, trembling and shaking, sense of shortness of breath, feeling of choking, difficulty in swallowing, chest pain and discomfort, nausea and abdominal distress, feeling dizzy, unsteady, lightheaded, and even may faint. You may have the symptoms of derealization, depersonalization. You may have the fear of losing control, going crazy, fear of death, numbness and tingling sensation that you may experience, chillness and hot flushes, and also episodes of the extreme anxiety. So these are the signs and symptoms of the panic disorder. Moving on to the diagnostic studies, how do you diagnose a condition? The first thing is you're going to do the history, you're going to collect the information from the client related to all these, traumatic events or anything the patient had the history of any kind of morbid conditions. Apart from that, you're going to rule out through the diagnostics test to find out if the patient is having the physical diseases. That is, by doing an EEG, electroencephalogram, you're going to find out epilepsy or other neurological deficits. Through the EKG, you're going to find out the patient is having any kind of the cardiac conditions. Thyroid studies you're going to do to find out the hyperthyroidism. So these are the diagnostic tests that you can conduct. Apart from that, you have to do a mental status examination to find out the status of the client. Now, moving on to the management, this kind of panic attacks and panic disorders are treatable with the use of psychotherapy as well as some kind of a psychopharmacological agents. The most common type of the psychotherapy which is used is the cognitive behavioral therapy. We're going to bring about a change in the cognition as well as modify the behavior of the client, desensitize the client to the feared situation or to the phobic situation which arises the anxiety. The second thing is exposure therapy, the technique that we use as a behavioral therapy. Expose the client to the panic situation so that it gives a way for the client to learn the healthier ways to cope up with such kind of a situation. So it is based on the learning theory. Continuous exposure to the panic situation makes the phobic stimuli makes the phobic stimuli to be desensitized. With each exposure therapy, the client becomes less afraid of the internal bodily sensation, that is, the signs and symptoms, and feels a greater control over these panic attacks. So that is the reason why you expose the client to the panic situation. Apart from these psychotherapies, you've got the drug regimen or psychopharmacological agents. That is, you're going to put the patient on the antidepressant group of drugs, especially the SSRIs, TCA group of drugs, benzodiazepine drugs to reduce the anxiety as well as the anti-anxiety agents that you may administer. So that is about the management of the panic attack by the use of the psychopharmacology as well as the therapy. Now, as the client, usually comes to the emergency room with the complaints of the panic attack, most of the clients rush into the emergency department. So, as a nurse, when you're working, what is the management that you can do for an emergency panic attack? Always see to it that you maintain a reassuring and calming attitude. Usually, this kind of a panic attack resolves by its own self by 30 minutes of the attack. So make sure that you give a reassurance and always remain calm during this kind of situation. If the symptoms are out of control, very severe, and it's causing distress, you can administer some of the drugs to calm down the patients, like benzodiazepine group of drugs, which will give a relief of the symptoms because the patient has lot of pressure within him that and fear also that he may have a severe physical symptoms or a heart attack. Find out if the patient is developing the panic attack because of the physical disorder or the conditions like hyperthyroidism or any cardiac related problems, and if the reason or the cause is the physical related disorder, you can shift the patient to the medical department. If you notice that the patient is having a repeated panic attacks, you can make a diagnosis of having a panic disorder, which may require the help of a psychiatrist. So that is the emergency management of the panic attack. Moving on to the nurse's responsibility, what is the role of the nurse? You've got the nurse priorities. The first thing, you provide a physical safety for the client because the patient already has got all these physical symptoms. See to it that patient should not end up with any kind of an injury or harm. See to it that you provide a safe and calm environment for the client. Assist the client in recognizing the anxiety. So, insight therapy is very, very important. Make the client realize why the patient is having the anxiety. Help him or teach him the alternative responses for the panic attack, like involving the client in the various activities or relaxation techniques, which can actually reduce his anxiety level. Assist the client with the desensitization procedure or the exposure therapy, wherein you should be available so that you can give the instructions, reassurance, and be with the client to overcome this anxiety producing panic attacks. As a nurse, you should educate the family, the worker community as well, to lend a helping hand or support to such kind of patients to overcome the disorder. These are some of the nurse's priorities that you can have for a client with the panic attack. Moving on to the discharge goal. So, what is it? On what basis or criteria that you can discharge the client? If you find out that the client stays in the feared situation, even if he experiences that kind of a discomfort, but still the client tries his attempt to stay in that anxiety producing situation, it means that the client has learned to overcome or he has got the benefit of the exposure therapy. If you identify the client is able to manage the fear, or if you find that the client is practicing certain techniques to come out of the fear, right? Like it can be relaxation, yoga, meditation. So various of the stress coping mechanism to overcome the fear, right? That is, adapted to that, then it is an indication that you can discharge the client. You can discharge the client if the client is able to confront the phobia, face the phobic situation, and also is able to desensitize with the stimulus. You can discharge the client if he shows or demonstrates the independence, okay? And also see to it that you plan for the follow-up so that he can come to you and deal with his needs, right? So these are the various goals at the discharge that you can have. If the client is able to fulfill these criteria, you can have a discharge plan and also ask the client for a follow-up visit. Okay, so this is about the panic disorder. Initially, the person may have the panic attacks. Later, it can convert in a chronic stage, can become a disorder known as a panic disorder, wherein the client will have the physical symptoms, worrying about those physical symptoms, and having the fear that we may have another attack can make the client to end up in the emergency room for the treatment. As a nurse, you should be able to recognize the panic attacks, be calmer, reassure the client, and give the appropriate psychotherapy and medication so that he will be able to overcome the problem. Hope you all have understood the topic. Thank you.